Hi, I'm Dr. Bruce Crawford. I created the Pilates program back in 2009, really looking for something to offer my patients as an alternative to the traditional recommendation of go home and do your Kegel exercises, because you know what? Nobody does them. Turns out movement works better when it comes to conditioning the pelvic floor. Turns out bladder control is a fitness issue. So I'm glad your instructor has assigned this video to you. This video we call Bladder Retraining. And what I want you to think about is the schedule that you void with normally. You can use a Bladder Diary. Maybe your instructor gave you one. Maybe you can download one online. If you do a Google search for Bladder Diary, you'll have about 1,000 options to choose from. Just pick one, download it, and keep track for 3 days. How often you're voiding, how often you're having that experience of, I've got to rush to the bathroom or I might not make it. And once you've done that, you'll have a sense of what a normal interval is for you, an interval with which you can generally make it to the bathroom in time. Maybe that's 30 minutes. Maybe that's 45 minutes. Maybe you have a need to rush to the bathroom once an hour. But whatever it is, start with that as the interval you'll use to perform timed voiding. What's timed voiding? Well, that means you're going to get a little digital timer. You can get it at Walmart, you can get it at Target, or even the supermarket. They're very inexpensive. And you're going to set it to that initial interval. Let's say it's 45 minutes. And when that timer goes off, even if you don't feel the need to empty your bladder, you're going to go ahead, walk calmly to the bathroom, empty your bladder. But if you get that experience of urgency, the fearful experience that you might not make it in time, you're not going to run to the bathroom. You're going to sit down, give yourself a message of reassurance, take some slow, deep breaths, the type that your instructor maybe talked to you about or that you've learned about watching one of these videos, and do a series of quick pelvic floor contractions and wait for the urge to pass. It will pass. Give it 60, 90 seconds, but it will pass. You might have an accident. But in the course of doing this, if you can control the urge for that 60 to 90 seconds and then walk calmly to the bathroom, you'll find that the bladder can be retrained not to contract when you don't want it to. That's what's creating that experience of urgency. Your bladder contracting when you haven't given it permission. Once you can stay dry for a week, at the interval you've started with, add 15 minutes. So you remember we started with 45 minutes, now we'll make it 60 minutes. And again, if you experience that feeling of urgency before your timer says it's time to void, sit down, message of reassurance, a series of quick pelvic floor contractions, wait for the urge to pass, and when it does, get up and walk calmly to the bathroom. No more running to the bathroom in a panic. Keep adding 15 minutes at a time until you've achieved an interval 2-3 hours, which really describes a fairly normal voiding interval, and you'll have noticed great improvement and you'll have done it yourself. I hope this is helpful to you. Keep practicing your movements. Your instructor has picked out specific movements for you that she knows you're going to benefit from. Keep practicing them if you want to get the results. Bladder control is a fitness issue, so you've got to do the work if you want to maintain the results. Thanks.